Hi, everybody. It's Dr. Linda with Dr. Ann Comi of the Kennedy Krieger Hunter Nelson Sturge Weber Center at Johns Hopkins. And today's session is on Sturge Weber and Port Weinstein and their relationship. So we're ready to see you post your questions. Hi, Alicia. Alicia Lego Linden just joined. Missy's on, so we know that you can see us. Just want to make sure you can see Dr. Comi clearly. There we go. Just a little better view. And get that a little bit better. So while we're waiting for some people to ask their questions, I've just been talking to Dr. Comi, and there is some new work out there that's being done to help individuals with Sturge Weber syndrome. Hi, Marissa. That have seizure disorders. So there's something called Charlotte's Web and oil, and they're from the cannabis plant, correct?
That's right. The work that we published recently actually is done with Epidiolex, which is pharmaceutical grade cannabidiol. It's actually not clinically available yet. Greenwich Pharmaceuticals is working with the FDA to try to get it clinically available, but we had a clinical trial that we recently published with children and adults with Sturge Weber syndrome and very bad seizures. And this was a small trial, but we did find that 3 out of the 5 patients who tried it were improved in terms of their seizure control. So one patient who had very bad seizures became seizure-free and has been seizure-free now for about 2 years. And the other 2 had a greater than 50% decrease in their seizures. And again, these were bilaterally affected patients in terms of their brain involvement who had multiple seizure medications that had failed. And the Epidiolex has been helping them. So we're hoping that the Epidiolex, which is again derived from the cannabis marijuana plant, but it's cannabidiol, not THC, not marijuana, will be available soon, hopefully, to be able to help patients with Sturge Weber syndrome and other causes of epilepsy.
Thank you. I see Jody Lee's on, Brooklyn. So we're waiting for your questions. Dr. Comi is great. Alicia has one. She got an MRI at 8 weeks and was cleared of Sturge Weber. Do we need to continue now 23 months old and no developmental delays?
So an MRI done at about 8 weeks of age does not definitely rule out Sturge Weber syndrome brain involvement. First of all, we need to know if the MRI was done with contrast. If it wasn't done with contrast, that definitely doesn't show the abnormal blood vessels. But even if it was done with contrast, if it was only done at 8 weeks of age, that can be normal, and still the child can have Sturge Weber syndrome brain involvement. So if you really want to be sure if there's no Sturge Weber syndrome brain involvement, then the MRI should be repeated after you're of age with contrast, and sequences like SWI, post-contrast flare should be done to exclude brain involvement.
Thank you. So Marissa, I'm not sure what your question is. Your daughter is 11 months and has had 3 laser treatments. Saima says, hello, doctors. Dr. Comi, her daughter Arwa is your patient. We are so grateful to you. Keep up the good work. You are doing well.
Thank you.
And Mary wants to know, very good info. Thanks so much. My daughter has a vascular malformation. Hello, Smita and Lynn Loy, and Scott's on now. So I'm trying to see, okay, yep, I'm looking for questions. So also you can go back and listen to this. So Marissa came back and said, if we haven't seen any seizures yet in my little one, are we in the clear? And I believe she said her daughter was 11 months old.
I think it was 23 months old.
Oh, 23,
right?
Okay, yep.
So about
11 months. Her daughter's 11 months.
11 months?
Yeah.
Okay. So not in the clear yet, no. So about 75% of patients will have their first seizure by a year of age. About 90% will have their first seizure if they have brain involvement by 2 years of age. But 10% of patients about will have their first seizure after 2 years of age. It could be childhood, adolescence, even adulthood. So no.
Yeah, we tell patients that think they're in the clear that we had someone in our foundation who was 38 years old when he presented with his first seizure. So we know now that it can be at any time. But it's good to know that it's only 10%. So you're saying the majority will present before 1, right?
The majority before 1, 90% by 2. But the oldest patient I ever saw who had her first onset of seizure was actually in her 60s.
Wow. So Jamie wants to know, does laser surgery on the skin relieve pressure on the glaucoma-involved eye?
Not as far as we know. There have actually been now 3 studies that have looked at this. 2 of them retrospective studies looking at chart reviews of patients who have had laser versus how their eyes were doing, and saw no relationship. And actually a study done at our center where we measured pressure before laser and pressure of the eye after laser, and we certainly didn't see any increase in pressure. There was a slight drop, but that's probably not significant. We tell patients that because the laser does not go to the deep vessels, they're very superficial vessels, that you're probably not significantly impacting the pressure within the eye.
Marissa came back with another question wanting to know about if her daughter should have a follow-up one because she's 11 months. But while you're getting ready for that, Abby said, we're scheduled to bring our daughter to see Dr. Comi in February. We are newly home with our daughter, adopted from China, who has Sturge-Weber. How many kids have seizures that mimic strokes? Our daughter has had 2. Both cause her to use the loose use of her left side. She's newly started on
Trileptal?
Yeah.
So we call those stroke-like episodes, and those commonly happen in patients, particularly young infants and young children with Sturge-Weber syndrome, along with their seizures. And that's because in Sturge-Weber syndrome, particularly in infants and young children, the seizures cause an abnormality in blood flow to get worse. And so during the seizure, blood flow can actually drop in the involved areas of the brain to what we call ischemic levels, where the area of the brain is not getting enough blood flow, and so they can get weak on one side of the body and look like they've had a stroke. If it's bad enough, the seizure goes on long enough, they actually can have a stroke where they don't get better. But many times they can have what's called a stroke-like episode, where the weakness comes back after a period of hours or days or a couple of weeks. And so that's not uncommon in the infants and young children, which is why we want to identify those infants early and educate the parents and the families about what seizures look like, and make sure that they have an abortive medication, something like Diastat, to give the child if they have a seizure, so that, and they have a plan in place. They know what to do if a seizure happens, so the seizures can be treated aggressively and hopefully don't go on for very long.
So Mia has a question. We're starting to get a little backed up like I thought, but that's all right. I've got them here. She said that her son went from unilateral to bilateral last month. He's on Onfi and Trileptal and aspirin. How do we find out if he would be a candidate for the CBD oil? We are currently seen at UCSF.
So Epidiolex is not clinically available yet. They don't have FDA approval yet. They're seeking to get it. Other formulations of CBD, you would have to ask your neurologist if their institution is allowing them to prescribe it or recommend it. Where I'm working, I'm actually not allowed to recommend it. I have some patients who've gone to other providers and gotten it. It is a drug, an anticonvulsant, a medication like any other anticonvulsant. So it's very important that if you do go on one of the other formulations of cannabidiol, that you let your neurologist know, because you have to have blood work like CBC and liver function tests monitored, particularly early on. So hopefully, though, in the next year or so, the FDA will approve Epidiolex, and then that will become another seizure medication that your neurologist can prescribe.
Okay, so we're getting a lot of questions. I mean, this is a generic from Scott Couples, who's our ambassador. He's an adult with the port wine V1, V2 in his 30s, and he wants to know, like, how would, what advice, if there's no Sturge-Weber to date, would you give to an adult, you know?
Well, I would ask them, do you have bad migraines? Have you ever had a seizure? I do sometimes have adults come to see me because they're experiencing something like really bad migraines, sometimes with a neurologic symptom, or early memory issues or cognitive concerns, and they want to know for sure that they don't have brain involvement. If that's the case, then it's sort of the same response as an infant after a year of age. Get an MRI with and without contrast, and some certain sequences on the MRI. One is susceptibility weighted imaging, or SWI, post-contrast FLAIR. And with that imaging, you'll be able to exclude or determine whether or not brain involvement is there. It's only when the MRI is being done under a year of age, particularly in very young infants, that it's not entirely sensitive. We can't exclude brain involvement in the very young infants.
Okay, so Jamie wants to know, will the laser ablation or gamma knife be useful for Sturge-Weber syndrome patients?
As far as I know, that's not been used in the brain yet. We're still trying to figure out to what extent the blood vessels, which blood vessels are needed to help with brain perfusion, and which blood vessels would be best to obliterate or get rid of. So kind of like in the leg, when they used to remove extra blood vessels in the leg, and then found that by removing those extra blood vessels, they were removing key blood vessels, and they didn't want to do that. We're sort of the same issue in the brain with Sturge-Weber syndrome. We don't yet have a good animal model for us to determine which of those blood vessels it's safe for us to get rid of selectively. So until we have a better idea of that, it's not entirely safe for us to just go in there and get rid of blood vessels. We are not sure how we would do that without causing harm.
Okay, well, we've got a lot of questions. So Lynn says, now, Lynn, I think you're misdiagnosed. She thinks she has a hemangioma by her nose and KT in her leg, so she likely has a port wine. And now she has problems with her eye. Her doctor said she has enlarged veins. Is it possible to have a hemangioma near her eye? So I think, number one, Lynn, you need to get an accurate diagnosis, and you can email Dr. Comi or me, and we can find out where a team is that can give you that diagnosis, because it sounds like she may have some vascular involvement in the eye with the enlarged vessels and a quote vascular birthmark near the nose. It's probably a port wine stain.
Right.
Yeah. So you can get in touch with us. Amy Bernard said her son has bilateral Sturge-Weber, is 9 years old, cognitive level less than 1 year old, so is nonverbal, legally blind. He's on 3 seizure meds and is pretty controlled. Breakthrough a few times a year. With the new trial you're talking about, when it comes available, will he be able to wean off meds, and will it help his bouts of agitation?
It may. One of the patients who was in the trial and is currently on it was able to wean off of 3 of her 4 other medications. she's the one who's seizure free, and she came on the trial on 4 seizure medications, was able to wean off 3 of the other seizure medications, and has had other improvements. So it's possible. I obviously can't guarantee that.
Right. Well, that's hopeful. So Sheena says, along with a port wine, have you seen issues such as cerebral cavernomas and C1 vertebral abnormalities with Sturge-Weber syndrome? She's looking for answers.
I have not seen that.
I mean, there is a thing called the cerebral hemangiomas, and they're different.
Yes,
I do have information on that.
Yes, so there's CCM,
Yeah.
cerebral cavernous malformation,
Right.
which is a different, caused by different mutations.
And that might be what it is.
Yeah.
But I have, I think, an article on that. Deborah Brubaker says, is there any way to tell if a 15-month-old baby is having migraines? If we can tell, do you recommend treatment?
So
She does have Sturge-Weber and has had seizures. You met her at our conference.
So there's no way to know for sure, but the symptoms that would make one suspicious are things like the child crying for no reason. You know, you fed, clean, changed diaper, no reason, going pale, vomiting, going to sleep, and then waking up and being fine. And that happening over and over again. And if you see that sort of series of symptoms happening over and over again, you could try giving fluids and Tylenol and see if that helps, or fluids and Motrin and seeing if that helps. And if the child has epilepsy, there are some seizure medications like Topamax, topiramate, or Depakote in a little bit older children that are both seizure medications and migraine medications that could be tried.
So Marissa asked again, because we didn't finish her questions and answers, that her daughter was 11 months old. Should she do an MRI or wait until she's older? She's had no seizures, no issues.
I recommend waiting till after a year of age, and that's simply because when imaging, in my experience, doing this now for almost 20 years, when the imaging is done after a year of age, I've had very few, if any, come back afterwards saying that negative imaging or normal imaging was done, and then later the child developed symptoms of Sturge-Weber syndrome, and imaging later was positive. So basically, imaging after a year of age seems to be very accurate.
So Wojtek, we thank you for writing in. She just said that her daughter has had 5 laser treatments and has a malformation of the face and tongue, and to thank us. Kathy's on now. Hi, Kathy. Lauren Sheehan said, do the areas of the brain remain consistent, or do they change over time? Similar thinking that a port wine stain can change during puberty. Do these same effects occur in the brain, and how does this affect involvement of the brain?
So there are a couple of main kinds of changes that can be seen. The first is that the extent of brain involvement can seem to change over the first year or so of life, in that if, let's say, imaging is done in the first year of life and it shows that there's one side brain involvement, that I'll often say that we don't know at that point that that's the full extent of brain involvement. So I have seen patients who've had an MRI done within the first year of life, thought to be one-sided brain involvement, when in fact they're bilaterally involved. And later imaging after a year of age shows that in fact they have both sides of the brain involved. And we don't think that that's actually because it's like a tumor or a cancer and it's grown or it's spread to the other side. They probably had both sides of the brain involved from the beginning. It's just it couldn't be seen on the initial early imaging. So that's one kind of change that's seen. Another kind of change that's seen later, usually in the after a few years or during the first few years of life, is that deep draining vessels can open, and that we think of that as a good thing. So initially you see on contrast enhanced images, the leptomeningeal vessels being seen with the contrast, and then during the first few years of life, deep draining vessels can open, and we see that along with stabilization of the seizure, stabilization of neurologic impairment. That's probably a good thing because it provides an alternate route for the blood to drain and stabilization of perfusion of brain to that area. And yeah, that's probably a good thing.
So Jillian is, Krista Cleanse Ross says she's excited to see you in a few weeks. She's enjoying watching this. Jillian Wilmuth said her son has bilateral Sturge-Weber and has had a left hemispherectomy. He is thriving, attends school, runs, laughs, counts, spells his name, happy, has advanced out of special needs. One wonderful report. I guess I'm just wondering, is there anything I can do to help him sleep? Melatonin is not working.
Okay. Sometimes we use a next step after melatonin is to check and make sure that there's no iron deficiency. And if there is iron deficiency, treat that. That seems to help. And then sometimes the next step is to try gabapentin. Sometimes that's helpful. If there's any signs of ADHD, then there are some medications like clonidine that treat both the ADHD and the sleep problem. So those are a couple of suggestions. I obviously can't be specific for him, but.
Right. So Ed says, I didn't post a question yet. Ed Merrill said his son has had seizures on both sides of the brain. He's had over 600 in 3 years. I'm assuming, John can write back that he must be on some kind of medication, right? And do these children outgrow the medication?
So there are a number of seizure medications now. I don't know what he's on, but other options, and I don't know how old the patient is. There are new seizure medications coming out every few years, so there may be newer options available. Also, I have patients who have been helped by vagal nerve stimulator, so that's a possibility as well. Also, the diet, Atkins diet or the ketogenic diet can be an option, aside from what we've already spoken about. So if I can be of assistance, just you can contact me through the VVF site.
Hi, John. John Sutton's on from the Sturge-Weber UK group and Sturge-Weber Awareness Facebook groups. He wants to thank us for support. But his question to you is, have you seen drooling and tiredness on their own as a seizure or blood flow episode issue?
So there are some seizures that can be just staring. And so with that, you could have sort of, I guess, tiredness and drooling. Yeah, so a decrease in responsiveness, staring, and decrease in activity can be a seizure. Normally, it's an abrupt change in activity and responsiveness, and then once the seizure is over, unless it went on for a really long time. If it goes on for a really long time, normally they would then go to sleep. If it's brief, just 30 seconds or a minute or two, then the light would come back on and they would resume activity. So those are sort of how you would sort of guess that was probably a seizure. If those are happening frequently, then you would try to get a prolonged EEG or perhaps an overnight EEG to pin that down and determine, yes, that's a seizure. It can be difficult with just staring spells to know for sure that that's a seizure. The other way to try to figure that out is to, I'm going to do this here, is to just grab the child's hand and say, Linda, okay, and look and really look for a response. Don't hurt the child, but get in their face, holler, shake the arm, and look. You can't startle a person out of a seizure. Okay, you can startle them out of daydreaming or dozing, but you can't startle them out of a seizure.
So if they don't get startled out of it, then they may be having a seizure. That's great. So Sheena, she had asked a question about the cerebral cavernous malformation in Sturge-Weber. I can find that article, but if you do Google cavernous, cerebral cavernous malformation and SWS together, or even by itself, you'll see a couple hits on it. Otherwise, I can send you an article. Jamie wants to know how a Canadian patient can get an appointment with you.
you can begin by, contacting me through the VBF website or emailing me directly. But these, they'll send you through to me,
Right.
and then I will contact you directly and share with you the information.
Right. We've been posting her email, which is birthmark.org/Comi, COMI, and that will get you directly to her. Greta says, is there a doctor in Hamilton? I haven't seen anyone in 20 years. 2 years ago, had 3 kidney surgeries. Slightly, her KTS heart did not like it. She died twice, and then they brought her back. Since her veins are now larger and more painful. I'm not sure where Hamilton is, Greta. I don't remember where she was writing in from. But if you go to the VBF website, we have a map. You can click on Find a Doctor, and it's a map of the United States of America. Then click on your state or surrounding states and see who we have listed. Kim Youngman DeBias says her son has a port wine on the right side of his face. MRI confirmed no brain involvement. He had 19 laser treatments. It does surround his eye. He's never had seizures. Sturge-Weber was ruled out. No glaucoma. His eye pressures have been good, but at 16 at a regular eye checkup, the doctor took a digital photo that showed a damaged retina. He was given the diagnosis of Sturge-Weber 2 weeks later at Will's Eye in Philadelphia. Our eye doctor at home does not see any damage. Upon physical exam, he does have expressive and receptive language disabilities. This may or not be related. Have you ever seen cases like our son?
Yes. So Sturge-Weber syndrome, I find it helpful to describe in just plain terms exactly what kind of Sturge-Weber syndrome one is talking about. So Sturge-Weber syndrome is a spectrum where the same somatic mutation can cause the birthmark, the port wine birthmark with Sturge-Weber syndrome eye involvement and brain involvement, or just Sturge-Weber syndrome brain involvement. In this case, it sounds like your son has been diagnosed with Sturge-Weber syndrome birthmark and Sturge-Weber syndrome eye involvement. So I'll say patient with Sturge-Weber syndrome eye and skin involvement. Whether or not there's brain involvement here, the question would be, when was the MRI done to exclude brain involvement, and what was it done with contrast? So if it was done under a year of age, then I would say that it has not firmly excluded brain involvement. And if there are some learning issues and the MRI was done significantly before a year of age, or it was done without contrast, and you wanted to know for sure that there was no brain involvement, then the MRI would need to be done with contrast, as I talked about before.
Melissa has a great question. She says that, when does tiredness from Sturge-Weber look like? What does it look like? She said, I can fall asleep and be out for 3 hours with my husband getting me to wake up. I feel like I can't help it and just fall asleep. Have hypothyroid, and my level have been tested, I guess, and her levels are all within normal. She's wondering about the tiredness because it is getting more noticeable. It seems to happen more when I'm resting on the couch with my legs up for swelling. She has KT and port wine stains on both legs.
Well, not sure exactly. For sure, you would want to, go over this with your physician. Would want to make sure, talk about things like your mood. Depression can present with tiredness and fatigue. You would want to look into any other health issues, thyroid just being one, but make sure that you're not anemic, that your glucose is okay. You would definitely want to go to your primary care physician, look at your blood pressure, all of those sorts of things, and see what your mood looks like. That's where I would start.
Okay. So Lauren says that her child has Sturge-Weber but no seizures. What do you recommend as a care plan or annual follow-ups?
So has Sturge-Weber syndrome brain involvement?
No, it's just must be the Sturge-Weber with no seizure. I'm
Okay.
not sure. I'm not sure if there's brain involvement.
Right. Okay, well, the eye the child needs to be seen by the eye doctor at least yearly, even if no eye glaucoma or eye abnormalities have been seen yet, depending on the age of the child. That, if they're under the age of 3 or so, that could be every 3 or 4 or 6 months, really depending on what the ophthalmologist has to say, but they should be followed yearly for life. In terms of the brain involvement, if brain involvement has been diagnosed, then I see those patients about every 6 months. More so more like every 3 months if they have epilepsy and their seizures are not fully controlled, or they're having symptoms and problems that need to be, I need to be working actively on the doses of their medications.
Great. So Kathy Wyrick is on. She's one of our reps for VBF, and she's in her 60s. She has Sturge-Weber. Her question is, she's been on phenobarb since 16. Would it be wise to get off it, being on it for so long? She's no longer having seizures, but maybe it's the drug keeping her from having them. I don't know.
Right. How old again?
She's in her 60s, and she's been on phenobarb since she was 16, and she does have Sturge-Weber. That is a really a difficult question for me to sort of address in this forum, not knowing sort of the details of your history. I would be hesitant to go there. Really, Sturge-Weber syndrome brain involvement does not go away with time, and the risk of having seizures does not ever sort of fully go away. So I think maybe she should talk
that's
to her
right.
neurologist about it.
Absolutely.
Yeah, because she's in Florida.
Yeah.
So Melissa lives in Canada, and she said that because she was the one asking. And she said the information has been very helpful. And she also asked, can the Sturge-Weber show up later in life? She was told as a youth she didn't have it. So you already said there's a 10% chance, right? Yeah. She wanted to know in your career if you know the average number of laser treatments a patient needs. But I know Dr. Geronimus and Dr. Nelson have addressed that. So if you want to go back and view our live chats with our laser experts, it's there. So John from the UK also has another question with laser treatments. Are there studies of long-term effectiveness depending on frequency, particular reference to effect of puberty in early years? And again, John, I just did a session with Dr. Nelson, and then before that with Dr. Geronimus, and they're on our vascular birthmarks page. So if you want to review them, they do a lot of discussion on studies with laser, long-term effects, when to start, when to stop, frequency, and laser settings. Ed wants to know if you agree with cannabis helping Sturge-Weber syndrome.
I think that, based on the small study that we did, that cannabidiol, which is one of the many compounds found in cannabis, may prove helpful, probably will prove helpful for some patients with medically refractory seizures. Cannabis, marijuana, has many, many active compounds in it. And so there, we don't have as much information. I haven't formally studied it. I think that remains to be determined, and I can't really speak to that. But cannabidiol, I think it's very likely that when we'll learn more when Epidiolex, which is pharmaceutical grade cannabidiol, becomes clinically available, I think it will be used for Sturge-Weber syndrome and many other causes of pediatric epilepsy, and we will learn more in addition to the study which we have published. It's published in Pediatric Neurology for those who'd like to look it up.
Okay, so Deborah wants to know, does the brain shrink over time no matter what in people with Sturge-Weber? My daughter has been on aspirin since 3 months old and has some atrophy.
That happens to varying degrees in Sturge-Weber syndrome, and it relates to some extent to the severity of the seizures and stroke-like episodes. So to patients who have had very severe, prolonged, repeated seizures and prolonged and severe strokes and stroke-like episodes usually have more severe atrophy. Also, the more extensive their brain involvement with these abnormal blood vessels also are at higher risk for atrophy. Alternatively, the patients who develop these open these deep draining vessels at an early and young age, they often have less atrophy. So one of our goals is to try to figure out what we can do to open more of those deep draining vessels. Aspirin probably helps that process. That's one of the reasons why we use it. But we still have a lot to learn about what we can do to try to open more of those deep draining vessels and reduce atrophy. But we think by aggressively treating seizures, particularly in the first few years of life when the babies are at highest risk for having atrophy and brain injury, that we can reduce that.
Do they have them on beta blockers, any of these people?
So when all of the discoveries about beta blockers and mangiomas came out, and that was just the most amazing thing, I did prescribe beta blockers for some of my patients who also had migraines, because beta blockers is a treatment for migraines.
And glaucoma also.
Yeah. And I did not see a big difference in their other symptoms. And so, it didn't appear to have any kind of a dramatic effect.
That it did for the hemangiomas.
Right.
Narissa has a great question. She has a 3-month-old who is suspected of having Sturge-Weber. She has not had any seizures yet, but parents in the various support groups she's in suggested having rescue seizure medication on hand. Do you recommend
Yes, I do.
I think that's a
so
great question.
The patients who come to see me, once the child is 3 months of age and older, okay, and again, you would need to talk to your neurologist or your pediatrician about this, as long as they have sort of healthy lungs and heart and otherwise healthy. It's important to have Diastat available to them so that if the child begins having seizures, they should place the child in a safe place, go call 911. If the seizure goes on longer than 3 minutes or so, then they would administer the Diastat while they're waiting for 911 to show up. Still go to the hospital because the seizure, the Diastat will only last for an hour or so, and then the seizures may come back. But at least that gives them something to do while they're some treatment to give to try to stop the seizure quickly while waiting for the ambulance to show up and to get to the hospital and get additional treatment started.
Great answer. Kathy wrote back again, the 60-year-old female that has been taking that drug since she was 16. She mentioned she's on another drug, carbamazepine.
Right. Carbamazepine.
And they've tried to take her off it 3 times, and then she has tons of seizures and ends up in the hospital. So it sounds to me like she can't touch anything.
Yeah, no, I mean, she needs to stay on her seizure medication. There are more recent seizure medications that if she was having side effects from the phenobarbital and carbamazepine that she could try switching to, such as levetiracetam and oxcarbazepine, which are 2 seizure medications that we commonly use. So if she was having problems with the seizure medications that she's on, she could try switching to other seizure medications, but she definitely should not just try to come off of seizure medications.
So Kim said her son had contrast MRI at 16 with no brain involvement. So should she be optimistic?
I'm sorry, what age?
16.
16.
With no brain involvement. So would he be in that 10%?
So MRI with contrast at 16 months of age?
16 years.
16 years. At that point, I would say that he does not have brain involvement, and I would just put that concern aside. I mean, we don't live in a world of 100% guarantees, but
But it's
I would
small risk.
Yeah, I would not
Small.
consider him to be any longer at any significant risk of brain involvement. I mean, so when a child is born with a facial port wine birthmark in the high risk area of the forehead, the upper eyelid, the temple region, what we call now the placode 1 region.
Or V1.
Well,
V1.
so actually we don't call it V1 anymore. Okay. because it's a somatic mutation that causes it, and the placode 1 is the sort of embryologic reference. Yeah. So and in any case, when a child is born with a birthmark in that area, depending on the size of it, they have anywhere between a 20 and 50% chance of brain involvement. But that means that the majority of those infants don't have brain involvement. So your child at 16 years of age with a negative MRI with contrast, they don't have brain involvement.
So we say average of 30%. So you're saying 20 to 50. Whitney says her son has Sturge-Weber, 2 seizure medicines along with aspirin and vitamin B6. Seizures are controlled with medication. She's wondering if he's not having seizures, can the brain die out without seizures? Can it be affected if he's not having the seizures?
I'm not sure I understand the question.
Well, as long as he's on the medication, will his brain stay there, or will it continue to atrophy and be damaged even though he's not having seizures?
I see.
Yeah.
Okay. Most of the time, what's been seen clinically and what has been shown in like functional MRI and PET imaging is that when seizures are controlled for prolonged periods of time, a year or more, neurologically and developmentally, the patient makes greater progress and does well. And on functional imaging, PET imaging, the function within that area of the brain improves. May not normalize, but it gets better, not worse. Now that may not be absolutely every patient all the time, but usually. So usually not having seizures, it means that child in that area of the brain is doing better, not worse.
So Teresa said her son is 12 and he has Sturge-Weber. He has port wine and glaucoma. He has Sturge-Weber, but he has the port wine and glaucoma, but no seizures. He's never had an MRI, went to see a neurologist, and he recommended not having one due to no seizures. But what do you recommend? Because he does have the glaucoma and the stain, and he's 12.
I present the information to the parents. At this age, at the age of 12, if the child is able to lie still for 30 to 45 minutes, then they would be able to get a non-sedated MRI. So then now you don't have sort of that very low risk of sedation. The only thing would be getting the contrast. So a single dose of contrast is considered to be pretty low risk. And then you would be able to set aside that question. As I said, at this point, his risk would be pretty low, but 10% of patients who have brain involvement present after the age of 2 years. Some families take that information and knowing that he's 12 and let's say he's developmentally normal, neurologically normal, and sort of do the calculation and say, that's pretty low. We're not going to worry about it. It's fine. If something happens, we'll deal with it then. Other parents and patients and families say, we want to know. We want to settle that question, put it away, put it to bed. We're going to get the MRI. And I don't think that there's a wrong answer or, a right or wrong to that. I think that different families have taken the same information and made different decisions, and that's okay with me. I think I tend to put that information in the parent and family's hands and let them decide.
Amy said, how often do you recommend a bilateral Sturge-Weber syndrome patient get an MRI to check on status of brain getting worse or stable? Or
I go with how they're doing clinically. So if they are not doing, if they are doing fairly well, no new changes, things aren't getting worse, and we're not planning anything surgical to try to deal with the situation, I don't do imaging on sort of some set schedule for either bilaterally or unilaterally affected patients. If, on the other hand, things have gotten worse, they're having a new kind of seizure or a new kind of episode, they've deteriorated, and we're trying to figure out why, then that's when I get, or if we're considering surgery, that those are the occasions when I get MRIs.
so Claudia, we only have 15 minutes left, and you've answered this before. Claudia's 38. She has a port wine on her right cheek and over her eye, but she's never had any seizures, no glaucoma, no problems. She's wondering if she should have one anyways.
If you want to know for sure, then the way to know for sure is to get the MRI. It sounds like if you have no migraines, never had a history of epilepsy, no cognitive issues, the risk at this point is really, really low.
Good. Lauren said that should a toddler have rescue medicine if no seizures as of 3 years? He does have Sturge-Weber with brain involvement, but his neuro said they would only call 911 if it occurs as an emergency. Just call 911, not to have the rescue.
If I were my child, I would have the rescue medication.
Right.
Yeah.
I agree. So we got a couple more questions. Diana said her son is 2.5, has facial port wine V2. It is not over the eyelid, not on the temple, no seizures, no glaucoma. We have postponed the MRI to the brain until he is 3. He's being seen by a pediatric neurologist and eye doctor since birth. Both agree he is not high risk. Are we on a safe side waiting until after 3?
Where is the birth?
He does have facial port wine V2.
V2. Oh, yeah. So,
she did say he has some language delays.
So if by V2 you mean the cheek only?
Probably the nose. This is what they think it is.
So
maybe.
All right. So one confusion is that some people will refer to this area as V2. Mm-hmm. Okay, and actually the high risk area is from the eyelid, the corner of the eyelid, up to the ear. Okay, up, and then so corner of the eye out to the ear, and anything in this area is also high risk. Okay, and then the forehead and the upper eyelid, so anything there. Okay, so if it's only down here, I agree, not really, no risk. All right.
So then Kim, because we only got a couple more. So Kim says her son is 19. His port wine darkens and changes. What are the odds of his Sturge-Weber symptoms changing, developing glaucoma?
The risk of glaucoma continues throughout life. It's highest if the birthmark is close to the eye. So the highest risk group has the birthmark over the upper and the lower eyelid, but if it's anywhere in the area of the eyelids, the nose, the outer canthus or the inner canthus, that patient definitely has significant risk of eye involvement. The patients anywhere in the high-risk area need to be followed at least annually for life. The 2 highest risk periods of time are in infancy and young childhood, and then young adulthood, but it can develop at any time.
Sarah lives in Tennessee, Nashville, and she just wants to know if you know any reputable laser experts, but I can have her write to Dr. Geronimus and Dr. Nelson, and they can answer that. John, our UK Sturge-Weber syndrome expert, wants to know if other patients experience sudden switch in behavior from calm to aggressive.
Yes, and so some of that can relate to impulsivity. We have patients with ADHD type behavior or learning issues, and so impulsivity can go along with that. Or we have some patients with mood issues, and so it can go along with mood issues. And so, we try to pin down what it relates to and then try to treat those symptoms.
Okay, so as we're winding down with only 10 minutes, Terry said that her daughter is 5. She has Sturge-Weber, no birthmark, no glaucoma, significant atrophy of the left side of her brain. Her seizures are not controlled with medication. She still averages 10 a month. They live in Canada and have asked about aspirin, but the neurologist says they don't do that here. Should I be pushing for it?
I use low-dose aspirin quite a lot, actually, and do think, in my experience, that it helps to control seizures. Udani et al. Published a series of 7 children with Sturge-Weber syndrome, where low-dose aspirin was introduced, and in every case, the seizure frequency was dramatically reduced. In one patient, they pulled the aspirin back again, and the seizures went back up, and they put the aspirin back on, and the seizures went back down again. And so, yes, there are a number of options that might be considered for medically refractory seizures, but certainly low-dose aspirin is one of them. I can't recommend specifically for you because I don't know all aspects of your child's history and why your doctor might be saying no to aspirin for you, but I can tell you that we use it quite a lot, yes.
Whitney says that she wants to know if there's any speech delays common with or language delays with Sturge-Weber children.
Yes, and it varies, because the extent of brain involvement varies from just one side in the occipital lobe to all of or most of the entire one side to both sides or most of both sides. The extent of neurologic involvement can vary widely as well, and the severity of the seizures also impacts the extent of learning or language delays. But yes, in more significantly involved patients, they can have significant language delays, yes.
So Melissa wants to know, can the blood vessels around the eye change later in life, but not glaucoma, but can there be a different eye condition with Sturge-Weber? So
the blood vessels in the eye can dilate with time, yes.
And everybody else is saying thank you. To clarify for you, Kathy, she was, Dr. Comi was saying not to change any of your medications. She was the one in her 60s.
Yes, yes.
And, she should talk to her neurologist.
That's right.
So she just said that again.
Yes.
Is an arterial venous malformation likely to expand in a Sturge-Weber syndrome brain? From Jamie.
I have seen very few, really, true AVMs in Sturge-Weber syndrome. I would be very happy if you wanted to send me additional information and imaging to try to help you confirm that that's in fact what you're dealing with. And in most cases where an AVM was suspected, when additional imaging with MRI, with and without contrast, MRA, MRV, and we have been able to determine that it's not actually an AVM. So I'm hesitant to answer that question, but yeah.
So we have, I see another question here. Did we say that? Oh, she said that there is a doctor in Hamlin. Oh, they haven't seen anyone in 20 years ago. 2 years ago, had 3 kidney surgeries. Oh, that was the same one. Okay, well, I think, thank you. Hope to see more. Okay, how can I? So if you need any answers, you can again reach Dr. Comi through birthmark.org/Dr. Comi. If you look up on the screen here and look at all the questions we've posted, Missy and Lisa and VBF staff have posted the direct link to the email for Dr. Comi or for myself. And if you go to birthmark.org, You will see Dr. Comi's picture on the front as our Sturge-Weber syndrome expert. Also, you can click on the link that says Find a Doctor. If you're looking for a laser expert, you can ask Dr. Nelson or Dr. Geronimus for who's the best in your region to treat the port wine stain with laser. So we have 4 minutes left. The next, I'm not quite sure yet, but our next Facebook Live session will likely be with myself and Leslie Graff discussing the psychosocial effects of living with the vascular birthmark. A lot of you have asked for that, and we've just been trying to coordinate when we can be together in person. So I am working on that. And we will have one with Dr. Rosen coming up in the near future for vascular anomalies of the extremities. So stay tuned to our website for these opportunities for us to give you a chance to ask the expert directly. And we thank you all for tuning in. And remember, you can go back and view this at any time, because Dr. Comi did talk about a new study with the, it is of the cannabis, but what do you call it?
It's cannabidiol.
Cannabidiol.
Yeah,
okay.
Cannabidiol, cannabidiol.
Okay, cannabidiol. So be looking to hear about more of that with some hope. Cautious optimism, I'll say, right? Cautious optimism.
And I just would like to, while I'm here, put for those who will be coming to see us, we've started a Friday morning multidisciplinary clinic with myself as neurology, Dr. Suskauer, who's our medical rehab specialist, occupational therapy, and neuropsychology, with the opportunity for those who want any combination of those evaluations to be done in one morning, seen at the same place, and the opportunity for us to sort of come together in our evaluation. We can help set those up as well.
So if you would like information about that, once again, you can contact Dr. Comi at birthmark.org/Dr. Comi. And also, I will be getting some information from her and posting it on all of the port wine stain and Sturge-Weber syndrome Facebook pages. So any of you who want to make an appointment or ask her questions about how to coordinate, because it will be in at Johns Hopkins, right, on the campus, which is on the campus,
that's
right? So it is an in-person type of multidisciplinary clinic. And when does it start, or has it started?
First week in December.
And then there'll be once a month?
It's once a month.
And what is it on what day?
First Friday of the month.
First Friday of the month. So that's excellent for everybody. I hope you take advantage of it. I wish you all a Merry Christmas. I want to thank Dr. Comi for this very informative session. So thank you all. We're going to sign off now. Thank you.
Take care, everyone.